next up is abbreviations on the do not use list, and this refers to pharmacology or to different medications. So we have a previous video on some great abbreviations that are used in pharmacology, and these are very common for healthcare providers, and you should absolutely watch that video. But we do have an abbreviation list that we have been told we should not use when it comes to medications. So let's look at some of the things we should never do for pharmacology abbreviations. So this list of do not use abbreviations is put out by the Joint Commission, and you can see their organization website here. They are a major organization inside the United States that helps to set the tone for all healthcare providers. So they put out a number of publications on best do and don't practices for healthcare. This is going to apply to all prescription orders. And the purpose of this is to really just reduce medication errors, right? You're going to see that a lot of these things on the do not use list are on the do not use for a reason. They are too close to something else, and if written too quickly, could actually harm a patient, and we certainly don't want to do that. Okay, so the first set of things that are on our do not use rules is that greater than or less than symbols that we often use in math. They are those little, right, sideways carets. However, they could be misinterpreted as a number. So we're encouraged to always write out the terms greater than or less than rather than use those math symbols. A capital U is often used as an abbreviation for units. However, again, because U can be used in a variety of different contexts, we should always write out units. And because we're often talking about diabetic medications, we certainly don't want to confuse the different types of meds and to give them the wrong dose. Next up is IU, which stands for international units, which is slightly different sometimes than units. But again, if you mean international units, do write out the two words international units. I know abbreviation should save time, but there are times where it can become too dangerous. And when we're talking about units inside of prescriptions, we are only going to use metric units. So while there are some other ways to dose medications, if you are properly writing a pharmacology script, metric units are the only way to go. Okay, next up is something we call a leading zero, and then we'll talk about the trailing zero. So in writing a decimal with numbers, it should actually have a leading zero. So when you're going to write something that is less than 1, you should do it with a 0 before the decimal point. So you're looking at 0.2 milligrams and never just writing 0.2 milligrams. And that's just so we don't mistake 0.2 for 2, which are very different doses when it comes to medications. On the flip side, if there is zeros after a decimal point, we really don't need to include those. And in fact, we could often add medications in the wrong dosage for the patient. So if you mean 2 milligrams, you're just going to write the number 2 followed by mg milligrams. We're not going to write 2.0 because if somebody confuses that with 20, again, we're giving them 10 times the dose, and that isn't really what the patient needs. While QD is often used as an abbreviation on tests, inside board exams for various healthcare providers, the Joint Commission really says that we should not be using it. It can be confused with QID, which is 4 times daily, and so really your best bet here is just to write out the word daily if you mean daily. All right, this little UG, or looks like a UG, stands for micrograms, okay? However, it could be confused with milligrams, and so you really should just use the term micrograms if that is what you mean in terms of a medication. Drug names. We never abbreviate drug names, so you shouldn't do it. Write out the full name of the drug, whether it is prescription or generic. Okay, versions, write out what you mean. MS. MS actually stands for some abbreviations for diseases, but in terms of pharmacology, it can actually mean two things, morphine sulfate or magnesium sulfate. And if you don't know that these two drugs are wildly different and would harm patients to take the wrong one, because it could potentially stand for two different things, make sure that you are writing out which one of those two that you mean. Again, the abbreviations MSO4, MGSO4, while clearly they have a chemical symbol to them and people should understand them, people may not, and they are close to each other. So again, either just write out morphine sulfate or magnesium sulfate rather than use just MS or one of its chemical abbreviations. Hopefully you've learned a lot about body systems, organization of the body, different med terms. Hopefully your study of medical terminology is going really well. Please use us as a resource. Ask us questions below. Please use all of the extras that we have. The more time you spend, the more words you break down, the easier this is going to become. And we know you're doing a wonderful job out there, so keep up the good work.